The Urban Impact Show is sponsored by Green and Wood Media Services. Green and Wood uses digital media to help businesses, political campaigns, and organizations grow while increasing their community impact. Green and Wood Media is pleased to offer a digital media buying fellowship to train, develop, and mentor young people interested in digital media, politics, and advertising. Learn more at greenandwoodmedia.com.
Hey, 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 hey. Hey, 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 hey. Black excellence, black beauty, and black pride. Black power from all diasporas coincide. Progressive truth and regression eventually collide. May the beauty of the people no longer be set aside. May the black queen's grace continually mesmerize the millions who couldn't see it when looking into her eyes. And the black man's plight no longer be the disguise. Oppression, emasculation, they wanna castricize him. Take him away from the black queen, put him inside prison for slave labor, he institutionalized. Wondering on the outside, is she willing to ride? Is she willing to ride? Is she willing to fight for the love, even despite the fact that he doing time? Love that conquers all will never fade with time. If she don't choose the love that appreciates every life, his flame might get dim and he may eventually.
Hey, everybody, and welcome back to the Urban Impact Show. I am one of your hosts, Rob Johnson, and I am super excited for you to be here with us today. Please take a moment, press that share button. That was the moment that I was giving you for you to press the share button. Please go ahead, press the share button again, and also bring people in because we're getting ready to talk about some very important topic. As you all know, here at the Urban Impact Show, our goal is to make sure that we're bringing out topics that are very, very important to our community. They're not just like hot topics, but they are topics that we should be discussing. Ain't that right, Brittany?
Yes, sir. Welcome back, everybody. My name is Brittany Dudley. I'm also one of the hosts for the Urban Impact Show. Super excited to have this conversation today on sexual health and AIDS. So I'll hand it over to Dora.
All right, welcome to the Urban Impact Show. And as you've heard, we are talking sex and World AIDS and HIV Day.
Talking about some sex.
I shouldn't have said we were talking about sex because Rob has been joking about this before this camera even popped on. So I'm going to
I'm gonna do it.
I know you are.
Wait to the end.
Just does anyone
stay tuned?
Just please. Yes, put him on mute right now, Matt. Put him on mute.
I'm screaming y'all like that.
Here's a few things for you all to know in case you didn't. World AIDS Day is observed every year on December 1st per our conversation today, first observed in 1988.
It's the year I was born.
Really?
Mm-hmm.
Oh. I didn't know you were that young.
Yeah, born in 1988.
Oh, well, I'm not going to tell y'all when I was born then because it was not 1988. So it is... I was in 1988. Okay, let me keep going. It is a day of solidarity, representing an opportunity for people worldwide who are affected by HIV to share their stories and experiences to remember. The theme for this year, 2021, set by the U.S. Department of Health and Human Services, is ending the HIV epidemic. Equitable access, everyone's voice. Today, we have Alex, who is to my left. He is a board member of Primary Healthcare's Prevention and Advocacy Board, a medical professional. And we also have Nola, who is not here in the studio with us, but she is on the phone. She is the Public Health Communications Officer with Polk County Health Department. And Nola, we're going to turn it over to you just to talk a little bit about what Polk County is doing as far as our sexual health and observing World AIDS Day. And we'd just love for you to share some information with our listeners.
Good evening. Thank you so much for having me on. It's wonderful to be a part of this by phone. I think the most important thing for our community to understand is during the pandemic, our STDs, people didn't take care of their health, their sexual health. So we saw our numbers through the pandemic really skyrocket. I look at our current STD numbers right now, and for the running total of 2021, Our chlamydia cases are over 3,212. Our gonorrhea cases are 1,848. Syphilis is 392, and HIV is 67. So these numbers are not going down. They'll continue to go up. And I think the most important thing for people to really understand is with STDs, the most common sign or symptom is there are no signs or symptoms. And so if you're sexually active and you're not using protection or you have multiple partners, you really need to make smart decisions and get tested. We encourage everyone and anyone who is sexually active to get tested.
Nola, can you tell us what age groups are you seeing as well? I know you shouted out those stats. To me, my mind goes straight to young people, but do you know the age groups where you may be seeing, that the highest cases, or could you break that down for us as well?
The thing about sexually individuals who are sexually active, STDs, there isn't really a discrimination of ages. So we know typically our highest numbers for, say, gonorrhea and chlamydia are between that 15 and 20, stage 24. But when we look at syphilis is an STD where people say that's an old one. We don't really hear about that very often. Our numbers are adults. And the one thing that's really scary too for us is that we have a really high case in congenital syphilis. And what does that mean? That we're seeing it in babies. Moms are giving birth to babies with syphilis. So that is really incredibly scary to us.
So Nola, really quick before Brittany, go ahead. You go first because I'm about to take it left.
Are you sure?
Yeah, go ahead. Yeah.
I was just going to say, how to, especially, I guess, our 15 to 24, how do we educate that age group in our community? Does it start at the schools, at home? What are some ways you think we can educate that age group on, things that they need to do to make themselves more aware, besides just, obviously wear a condom?
Yeah, 100%. I think the biggest thing is having conversations about it, because it's 2021 and we still think that sex is taboo. It's uncomfortable to talk about it. We're uncomfortable to talk about it. But the thing is we need to hear it from our parents, our coaches, our schools. We need to have that conversation open and candid, because when kids are open, when we're open with our kiddos and they understand, they're more apt to seeking prevention methods. They're more apt to knowing more about it. If we make it that something is not to talk about, then they're not getting the right information. And then if they don't get the right information, they're not using the right forms of protection. So it's really just having conversations about it. It's having crucial and hard conversations, but those crucial and hard conversations are so important to keep our kiddos healthy and safe.
Thank you for that. I am, and this is really a question for Alex and you, if both of you all wouldn't mind jumping in on this. You mentioned exactly where I was going with this, right? Like, it's 2021 and we're still taboo on talking about sex, right? Everybody, everybody's trying to figure out, what's going on in somebody else's bedroom. And especially, when you look at it, you got the church, and you have community, you have all of these other factors that are playing into this. And so I was looking up some stuff when it comes to this. I'm gonna say this statement, and then I'm gonna ask a question. What we also see is that we have an older population who are getting what they would call the clap, right? This chlamydia and gonorrhea stuff, which is happening to our older generation, and I'm talking about 50 plus. Like, the deacon and the deaconess, something is happening, something is happening, where they done got the clap, and so then we in this situation. But then we get into this thing with our young people, our high schoolers, where our high schoolers are contracting sexually transmitted diseases, and then they're hiding it, and then they're spreading it because they don't know what to do. So my question is, how do we take this information and make it tangible, but also, I would say, accessible? Because really, before this conversation, what are we in? Are we in December already? Are we almost in December? So here we are, a day away from December, and this is the first time I'm even having a conversation about AIDS or STDs. All year, I've gone 11 months, haven't even discussed it, haven't even thought about it or anything like that, right? But our babies are the ones really in the midst of this stuff. How do we make this information more like in your face, more accessible? Because they're not going to go look it up. Like, what should we be doing? How should we be taking this to them?
You know, I think the biggest thing and the biggest concern that we have right now is STDs. The most common sign or symptom with STDs is that there are no signs or symptoms. So we have the 15 to 24-year-old range. I don't even know they have STDs because they're not having that conversation with their parent, their guardian, their person that they trust about getting tested. We still have adults under the impression that if I engage in oral sex, I can't get an STD. Well, any time you have any type of sex, whether it's oral, anal, or vaginal, you can get an STD. It's common. And I think the most important thing is just having conversations. You know, it's kids are going to have sex. Adults are going to have sex. Everyone is going to have sex, okay? We have to get off the topic of, well, my kid won't do that, or everyone is going to have sex sometime in their life. So it's about having
they have
conversations.
oral sex, anal sex, and vaginal sex.
Absolutely. You're having any type of sex. Any type of sex. And if you're uncomfortable talking about it, there are resources, there are places that people can get the right information, and we want them to get the right information. So find someone in your life that you're comfortable talking to about this. At the Polk County Health Department, we are so fortunate, so incredibly fortunate that we have 5 public health investigators on staff. And what they do is they work to investigate STDs. We have STD nurses that test for STDs. The best part about this is that you can't shock them. They have seen it all. They are open, they are honest, they are confidential. I mean, you can't, in this line of work that we do, you can't be judgmental. You need to have open and honest conversations with people. And that's what we strive to do at the health department.
Alex, any thoughts?
I think talking about that, I just focus on young people, especially this adolescent growing for the young age. Like when you're growing, you have that tendency of trying new things, and then the more you see things passing on by your eyes, you want to try that things. Like many adolescents are just exposed to the new world that we have, the social media platforms that have this sexual education that are not really accurate. They're not accurate enough to educate them or to give them true information. So these young people tend to try the false information that they get. I think what I'm trying to say is that to avoid that, we need to leave behind the mind of thinking that sex is a taboo, and then go down on the floor, teach them about the actual sexual education, like to know, teach them from the ground to know their health issues, to know what are the risks when they engage in sexual behavior. So when they engage themselves, like we don't need to say sex is bad, but I don't mean to say that, but sex is good, but they need to know how to behave when they're doing sex. They need to know what steps they need to take to make it healthy and safe for them. So what I say is that we need to, parents, families, teachers, like in school, like they have curriculum, they are meant to be teaching about sexual education, but whoever is teaching that is someone who doesn't believe in giving the information to these young people. So they will always have the tendency to pass on top of the information and then hide the true information behind, because they don't want to expose these kids to the actual reality that is out there.
Yeah.
Which is bad. We don't need to keep denying the fact
because
that
YouTube
kids
is teaching them now.
Oh yeah.
YouTube is teaching 6-year-olds about sex and
I think that, have the conversation, but I think we have to have the conversation earlier too, because then when kids get to 15 and 16, like in high school, they kind of shy away from it and it's uncomfortable. Think about yourself. Like I remember having that conversation with my mom was very uncomfortable, but they need to know what they're doing. They need to know the consequences of it, whether it's sexual transmitted diseases, whether it's having children early, and they need to know the signs of
I gotta say this. I took my niece and nephew to the gun range. Y'all know they're 8 and how old is it now? 11. So I took them to the gun range, and at first my sister was like, "No, they can't go to the gun range, right?" And I'm like, "No, I'm gonna take them to the gun range. That way they know what's on the other side and the responsibility that is on the other side of pulling this trigger, right?" When I took them to the gun range, they then took a class. Took a class on learning the on learning the gun. They took a class on shooting the gun, and then they got practice on actually shooting the gun and knowing how to work the gun and stuff like that. And I feel like in moments like what Alex was just saying is we have to educate. You know, we don't want to talk about sex because we don't want them having sex. You know, so we don't want to do it, right? And then you know you have to be honest with kids. Like you can catch herpes from oral sex. You put your mouth on somebody,
And
you
show
can
them what it
yes,
looks
like
so that
you
they
can
know.
catch this by doing this.
Yeah.
And then you walking around with this unbeknownst to yourself. Now you involved with somebody else because the other person that made you mad. Now you involved with somebody else, and now you done spreaded this to somebody
Or
else.
you say your little sister, you have it, your little sister drink off your cup.
Yes.
And you're spreading it.
Well, no, not necessarily.
Uh-oh, come on,
There we
come
go.
on.
Come on. There we
Come
go.
on,
Yes.
then.
Educate
Public
us,
health.
Nola. Educate us.
So there is a difference between genital herpes and herpes simplex 1. So herpes simplex 1 is what we call like a cold sore. And then genital herpes is herpes simplex 2. So there is a difference in how we get them.
I
So
love this. Come on.
if I have
Give
a
us more.
cold,
Give us more.
If I have a cold sore, which is a herpes simplex 1, yes, that is an easy way to pass that to someone. But when we look at herpes simplex 2, that's a genital herpes, and that is more the sex contact. Does that make sense? It's more coming in contact with someone's vaginal fluid or semen that have the herpes virus, or we come in contact with the actual sore through a lot of cases genital rubbing. So that's kind of a little bit of the breakdown with that.
Where did this stuff even come from? Like, how, like I'm so like, what is going on? Like, how did this stuff even come? Alex or Nola, somebody help educate me and the public, because I'm sitting here like herpes. Who thought of the word herpes? Like, who thought of AIDS? Right? Like, who? Go ahead. Yeah, go ahead.
So, okay, well, I can tell you kind of the history of HIV. We know that HIV, so viruses and diseases, we kind of look at them a little bit differently.
Yep.
So a virus and diseases have to have a host. Well, who is the host? It's either me, a human, or an animal. Correct?
Yep. Correct. Yep.
So when we look at HIV, kind of the history of it is HIV became, so SIV is the form of HIV in chimpanzees. And so how it was transmitted to the humans is we believe in the public health science world that somehow an animal bit a human, and that virus was able to become SIV in a chimpanzee, and it became HIV in a human. So it crossed the animal-human border.
Wow, I know we're gonna have to sit on that and think for a minute. We're gonna take a quick break, but Nola, thank you, because this is why we're having this conversation today. We really need to be educated
Absolutely.
on this. We need to be educated as hosts. You know, those that are listening to this conversation need to be educated as well. So we are gonna take a quick break. Don't turn away. Come back and join us on the Urban Impact Show. The Urban Impact Show is sponsored by Green and Wood Media Services. Green and Wood uses digital media to help businesses, political campaigns, and organizations grow while increasing their community impact. Green and Wood Media is pleased to offer a digital media buying fellowship to train, develop, and mentor young people interested in digital media, politics, and advertising. Learn more at greenandwoodmedia.com.
Testing 1, 2, 3. There it goes.
Testing 1, 2.
Welcome back to the Urban Impact Show, where we are talking about sexual health and HIV and AIDS. We're going to continue this conversation with HIV. And the first question I have, because I think we miss the two, is there a difference between HIV and AIDS? It seems like we hear more about HIV, and I can remember when, each time I was pregnant getting tested for HIV, but not so much AIDS. So let's talk about that. Is there a difference between HIV and AIDS?
I don't know. Like,
There is
if I'll
a
be able
huge-
to help.
Go ahead, Alex.
Nola, are you going to?
Go ahead, Nola.
Alex, do you want to go?
Oh.
Okay. So there is a difference between HIV and AIDS. So let's talk a little bit about how HIV starts. So HIV is the virus that we get through having, we can get it through blood, vaginal fluid, semen, and breast milk. So we see it through sex. We see it through, we can see it through sex, through individuals using needles for drugs. We can see it through, we used to be able to see it through blood transfusions, but that stopped in 1992 because now we test blood in the United States since 1992.
Wait,
So what
92?
happens is,
We didn't test blood prior to 92?
no, we did not. Nope, we did not. So individuals were able to get HIV, so that's why we test now. Have you all heard of the Ryan White Act or Ryan White?
Yes.
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 Okay, so Ryan White needed blood. He needed blood transfusions, and how he got HIV was through a blood transfusion. So because of the Ryan White laws, now we test blood in the United States. So anyone who gives blood, we test them for bloodborne diseases now.
I don't know if I can just contribute to what she said. Like, I just want to keep it simple. Like, HIV is just, as she has been saying, it's just a virus. When
Right.
it becomes AIDS when your body defense system has failed. So you get to that extent, optimistic infection, like you get so many infections in your body, and your CD4, what I can say, the body system, defense system, when they are failed, they just keep getting low because HIV doesn't attack other places. It only goes straight to your defense system. So it breaks them, and then you just keep your body will keep failing until you. So it gets to become AIDS when you're totally failing. So that's when your body defense system has failed. You're almost under 200 CD4, which is so. And so like.
And do you want to tell what? And CD4 is the amount of virus. So when you say CD4, CD4 is how we detect that virus in your body. So we would how we test for HIV is a blood test, and so then we have to detect that virus in your body. Mm-hmm. And when you go from HIV to AIDS, that means the CD4 has completely taken over your body.
So, Nola, I think when a lot of us heard about, and maybe just because I was younger, a lot of us heard about AIDS or HIV was when Magic Johnson tested positive for it. And so, did he have AIDS or did he have HIV or did he have both?
He still has HIV.
Okay.
So what is so amazing about modern medicine is when we first heard about HIV in the United States, I mean, I think of about the 1980s and 1990s. If you had HIV, it was a death sentence. And now you can live with HIV and live your whole life and die healthy, die of old age. Our medicine has become so amazing that you can, your viral load is so low, that means it's virtually undetectable. So if it's undetectable, it's untransmittable to your partners. If you are taking great care of your body, you're staying on your ART, antiretroviral therapy, you can die. Your HIV will never turn into AIDS.
Because I think that's kind of like a stigma that people think, like, I have HIV or have AIDS, you're going to automatically pass it to your partner. Or even when Magic continued to play basketball, like, that was a huge deal, because I think we weren't educated enough in it, so people were thinking like it could be passed, along pretty easily.
Alex, can you give us a little bit more of your background? Because I feel like we may have missed for the benefit of our viewers. Just give them a little bit more of kind of like your background.
Like what I can say is that I'm an activist. I'm a devoted activist in sexual health and HIV, especially in young people. My whole
Alex,
past
tell
8
them
years.
about the work you did in Rwanda. That's so important for them to know your background.
My whole past year, I was working as an activist in the sexual reproductive health, especially in adolescent young people, back in Rwanda, in Africa. We have, what I can say is that HIV, where it's not like here, it's more serious. And when you get to more serious, it's a place where you get to see countries with more than 80% of the population have HIV.
Wow.
8, sorry, not 80, but 8. 0.8% of the population have HIV. It's a place when you see everything that when you get to the medical health, it just comes late. Like the research are being done, but we get the solutions because we are not doing the research. If it's medication that will come to Africa when it's already, many people had died. Like when I get to my country, we started testing for HIV around 96, and then we started, the first medication got to the country around 2000. The US has already started giving medication. It was really so bad, and then many people had died already. So what I can say is that you get to understand when you get to young people being exposed. We had this scenario, that's when we started educating more about sexual health, because we had this scenario of having kids, young girls getting pregnant at the age of 15, 14. It's really crazy. But when you say, are they only getting pregnant? No. They're getting pregnant, that's one. They're getting HIV, they're getting other sexual transmission diseases like their syphilis and other things. So we started educating them because it was just an issue that what I was saying, that it was a kind of a fight with the Catholics because they don't believe in contraceptive. But when you get to that, you have to understand that young generation are exposed to, or they are doing sex already. Let me say not exposed, because they are practicing sex. If they are practicing sex, they are exposed to this all like to HIV and other STD. So by denying that, we are denying the fact that they need to be healthy. We are denying the fact that they need to know what they are risking. And they need to take care of their health. So my whole life is just, I was a public health activist and a human right, educating about, mostly in HIV education and sexual reproductive health. That's a bit of my background.
Well, thank you for that. Yeah, I was picking up on that. Like, are you also in the medical field as well?
it would go back far beyond to my like I'm not in a medical field. I did economics in college, so just some far beyond of public health actually. But when you're graduating high school back home, you have to do internship. So my first internship was in the medical facility, and then many people there were like, because in Rwanda we had this French speaking system, and then many people there were only speaking French, and then I was exposed to learn more in English and then educate. So just I was exposed to this public health system, and then I started growing this passion to work in the public health field. And then I had these people that involved me so much, because if someone is sending you on a mission, you're young, but they keep breathing that passion in you. They mentored me to be a public health activist, and then I ended up being in this field forever.
Yeah. Well, thank you for the work you're doing.
Thank you.
This is some serious stuff. I think we got to take one more break. Yep, we do. But here's the thing, y'all. The one thing that we really want people to understand is that young people are having sex.
Yeah.
And the more that we make it uncomfortable for them to not tell us or not talk to us about it, is the less healthy and the less safe that they will be. And we ourselves have pushed them to a public health crisis. Because if we don't make it more comfortable for our young people to come to us and have open dialogue about this, then you're looking at a situation where they're making decisions based upon all they know and not what all they should know. So, Tawana, Brittany, any before we go to break?
No, I was just kind of to piggyback on what you were saying, make it easy for them in conversation. And I think it's like, think about how that conversation would even go. You know what I mean? Like to kind of smooth things over to where they don't feel uncomfortable. Because I think about my younger self, like how that conversation would have went with me and my parents to make me more educated.
When I can add on that, like when I can say, like, let me say we're just talking about HIV mostly. When I can say that is that HIV is no longer a threat. It's no longer, I can even grade it the second or the third in the world of pandemics. So the only thing that makes it a threat is the stigma and the discrimination that is out there. The way other people, the way they think of HIV, the way you think HIV is AIDS, the way you don't understand HIV, you call it a threat. It's no longer a threat, because like we are talking about equal to you, like when you're HIV positive, you're able to take your medication while you get to the extent the viral load of you in your body get low to the extent it's undetectable. When it's undetectable, that means you cannot transmit HIV. That means it's no longer a threat there, because you can live a healthy life. You can marry whoever you want. Many people don't like, when you get to the world of relationship, romantics, they think like when you marry someone who has HIV, you get it automatically. But when they're undetectable, you're safe. So just like the community need to understand that HIV is no longer a threat. HIV is just a virus that can be manageable.
I know some folks is gonna jump all over that. They gonna be on there. Nah, bruh. We talking about HIV.
That's the first thing you hear. Like, I got
HIV is now just as manageable as like diabetes. I mean, you really have to think about it in that sense.
I hear what y'all saying, though. I hear what you're saying. But I'm telling you right now, folks gonna jump on this and be like, no. Like, can you
We've
imagine
come a
going on
long
date
way.
with somebody? Can you imagine going on a date with someone and then they tell you, by the way, I have HIV? Like,
That's where education comes in, though.
I
you know, I'm just saying.
But
That is 100. That's 100%.
Madison just said, then you can ask, what are your viral levels?
So do you carry it with you? You carry that information with you?
People are living healthy and happy lives every single day. They are in happy, healthy relationships, having children. Their children will not have HIV. You know, we have to really think about it. It's really come a long way in the last 30 plus years in the world of HIV. It is no longer a death sentence. People live happy, healthy lives with their partners, with their kids.
No, I'm not confusing the medicine. I am just simply stating the fact that if I'm sitting across the table from a young lady and she says to me, "I have HIV," I'm a realist.
What if she looks like
I'm not
Beyonce?
going to ask.
What if she looks like Beyonce?
I'm a realist. I'm not getting ready to ask the question of,
Yeah.
what are your viral
What do
levels?
you say? Check, please.
So
Check, please. And I know that's the problem, and that's why we having this conversation. We gotta go to break.
We do got to go to break. See, Rob always says the things when I really want to say something, but we need to go to break. So I'm going to hold my peace for about a couple seconds. We are going to go to break. We will be right back with the Urban Impact Show.
Yeah, reiterate undetectable.
I'm gonna leave that to Dewana.
Welcome back to the Urban Impact Show. I've composed myself now so that I can say a few things. You know, I get it. If someone does say that at the table, it's a normal human reaction to go, okay, maybe I need to get up now. But what we would like to encourage in this conversation is that that's not the reaction you take, and that you don't run out of the restaurant when you hear that. What we are encouraging you to do is ask more questions. We are asking you to ask for, did we say viral levels? Is that what we said? We're asking you to get that information and know that we said that you can be undetectable, which means that you're not going to be transferring it to the other person. It's normal to have the reaction of, oh, I can't believe that. But we want to encourage you to continue the conversation and to get to know the individual and figure this thing out. We just don't want to be running out on folks. This could be the person you're going to marry. And that's like the first thing you're going to do is say, I'm out the door. I'm out the door.
You know, here's the whole thing concept of the way to look at it. 1 in 4 are closer than one, more close to 1 in 3 individuals have an STD in their lifetime. So that is almost everybody you know.
Say
almost
that again?
Everyone you've maybe had a partner with. No, not HIV and STD.
No. I'm saying just say those numbers again.
1 in 4, and it's probably now closer to 1 in 3 individuals will have an STD in their lifetime.
So 1 to
practically
you.
everyone has. I mean, HPV. Okay, HPV is human papillomavirus. 90% of the population who's had unprotected sex has HPV. HPV is a sexually transmitted disease, an STD. So, I mean, our population has STDs. It's really about not stigmatizing the person. It's really about having just conversations with them and getting to know them, because everybody comes from different walks in life, different parts in life, and it's up to us to be good humans and help them and work with them, talk with them. I mean, that's just what this is.
Thank you, Nola. I agree wholeheartedly.
Glad Dewana does.
I do agree. I agree wholeheartedly. To me, having this conversation is no different than anyone saying they've got any other disease or any other thing that they've got going on.
Can I be honest though?
Yeah.
I'm not going to discriminate against you, right? Because that's not what we do, right?
Right.
I'm not going to look at you and degrade you or anything like that. But I'm gonna be honest. If you tell me I'm probably no longer interested, which is probably why people don't. Which is probably why
They
people
don't say anything.
aren't honest.
Right.
But I
Which
think
is why
that's
people-
because you don't. It's
Yeah.
not normal for people to come and say, like, on the first date or even the first year or so, to say, "Hey, I've had these STDs." Or I
Did you
currently
just say
have
the
these."
first year?
Yeah, I was gonna say it's a long time.
No, I'm saying.
I've been with you a whole year,
You ain't said
and you
nothing.
didn't tell me you had AIDS.
No, not AIDS.
I mean HIV.
Not even. I'm saying any type of sexual transmitted diseases. Like, that's not conversation our community is comfortable having.
You are so okay. You're right. You're right,
Uh,
Brittany.
I think what we need to do is just to encourage the
Yes.
community to not react the way you can act.
The way I'm reacting.
Yes.
'Cause
Yes.
What I'm
Yes.
saying is this, because
Yeah, and you know what, Nola and Alex, I'm okay with that. You know, this is why we do this show. This is why there are other hosts. You know,
so because what I'm saying is this, it's just like the more you act like that, like I'm coming to you and then I'm saying, oh,
It is a
sorry,
very
I'm HIV
vulnerable
positive.
place to
the way
be.
you act, that
Yeah.
means in my mind I would say, okay,
I
I will
can't
never
share
do
that.
this thing again
yeah,
in front of
okay.
anyone, on whoever it is.
Okay.
I will just go quiet.
I got
Be
you
on
on
a
that.
blind date, let me call it a blind date, and then the person, I won't even mention that about my HIV status, because the first reaction I got when I said that was bad. So the more we keep it, the more we keep that stigmatized actions, like already you're acting shocked, you act. So when I say it's no longer a threat, it's actually no longer a threat. So we shouldn't be shocked when you hear that. You shouldn't be like surprised. Oh my God, do I have it? Or you just like need to be like if you're dating someone who has diabetes, like when she said to you like I have diabetes, what would you do? Would you be shocked? No, because you know like it's just something wrong. So you need to know that
You know, and
HIV is no longer at that level of threat, because medication and is there, and then this level of threat has passed.
We're gonna have to do some more shows on this because
Yes.
it feels like
Absolutely.
y'all are trying to tell us to look at HIV like people look at diabetes, and
Which is
I
You
know
know,
some folks ain't buying
it-
it. You know,
well, and
being
understandable to that point is HIV is still a very serious disease. All STDs
Yeah.
are very serious diseases because they can threaten your life.
Yeah.
But what we're
Diabetes
saying
too,
is
you
now
can
there
die,
is
right?
medicine that makes
limb
it
cut off.
you can live a manageable life. And I think the biggest thing with STDs and the stigma about it is that in what we are trying to really do in the public health world is try to really reduce those barriers and break down those walls. Because when we
Yeah.
start having stigmas, what do? We start building those walls right
do.
up again. And that is just somewhere we never want to be.
One of the things that I've heard before is the medicine for the disease, is it really expensive? Is it affordable? Because one thing I remember it being, Magic Johnson was able to get the treatments he got because he had money to do that.
I don't know, like if you know, I
so-
can respond to that, but I know medication are available for everyone
Okay.
and accessible. What you just
Right.
need
We-
to
so-
is to come out and just,
So
there's
Go ahead,
no,
Noel.
in Iowa, we have the Ryan White Act, and the Ryan White Act makes HIV medicine affordable for everyone. And if you don't have the financial means, now here, I think one of the best things that medicine has done is it's created PrEP. What PrEP is for individuals who may be at high risk for HIV. So HIV may be high risk for individuals whose partner is HIV positive, whose partner is HIV. Let's say they use needles for drugs. They are a man who has sex with men, something that makes them more high risk. If you take PrEP every single day, you have over a 95% chance of never getting HIV. So look at how far modern medicine has come.
So I want to make sure I heard you correctly. So there's a medicine that people can take, whether they test positive or negative for HIV?
Nope. You have to be negative for HIV. This is a medicine. So PrEP
So it's a
is
prevention
a medicine that you would take if you think you are at high risk for HIV. So there are people who fall under categories for high risk of HIV. Maybe
and
let's
that's
say,
affordable?
like I said, you're a man who has sex with a man. Your partner is HIV. Your partner is HIV. You're a sex worker. You are using needles for drugs. You would take PrEP every single day of your life, and it helps prevent your chances. We know it's over 95% effective.
Yeah.
So look at how far medicine has come.
Wow.
So adding on that, like it's not like it's a prevention, which is actually
it's a preventative
accurate and
method.
good. It is what I can say that you might be there's two types like PrEP and PEP, when you can prevent yourself from getting HIV before what is pre-exposure prophylaxis and post-exposure. There's this PEP where you take like, you had sex with someone who's HIV positive, and then but before 72 hours passed, you can still take medication that can prevent you from getting HIV. So you're exposed, but you cannot get HIV because you cannot be infected with HIV because you're able to take the post-exposure prophylaxis, which is PEP, and then or you can prevent you before you have sex with someone who's HIV positive, or some like if you have sex like some people, you might not be having sex with someone who is HIV positive, but you have many casual sex.
So what if somebody
Correct.
doesn't disclose that they have HIV? I get HIV. Can I take legal action against them?
They have to willingly know they have HIV, and they have to know it, and they don't disclose it. So a perfect example is, here's one of the best examples that I can share. I had a client, he was in the hospital, and he tested positive, and he called his last partner and let them know, and the partner goes, "Oh, didn't I tell you I was HIV positive?" Right there, that partner openly admitted it, and then you can press legal charges. But here's the thing. People can live a whole lot of years before they even know they have HIV. So every body is completely different. How one person reacts to HIV is completely different. So you may not even know you have HIV. You have to willingly know. And so that all comes into a whole different legal realm that I don't know that I'm not equipped to talk about, because legally is not my jargon, but they have to willingly know. And then there's ways that you can press criminal charges.
Okay, so I just have a question. How often should we be getting tested for HIV? I know, is it is it something you should do every year when you go get your doctor's, your annual physical? Like, how often should you be tested for HIV?
So I think when I don't know if Nola would just say for the clinical part, but what I say, when you're sexually active, that means, and we don't have like one partner, you having many partners, you should be texting at least every 3 months. On my
100%.
You should be texting like regularly, because you need to know, because HIV itself has a window period that can get, and then there's so many weeks that you can spend with HIV in your blood, but without knowing. Even when you go to get tested, you won't be able to see it. That's why we need to be like, when you're sexually active and you have sex so many times with different partners, you should be at least testing like every 3 months to make sure that you know your accurate result, like often, like every 3 months. That means 4 times in a year. Than having to stay like quiet and say, "Oh, I'll be testing once in a year." But because when you test once in a year, you won't even know where you got it, and you won't even know when did you get it. But testing.
I know we're getting like close to our time being up. We have to have a part 2 to this discussion, but I wanted to know, when we said we should be getting tested, maybe, if you're sexually active, at least, 4 times a year, maybe if not, maybe once a year. But what is testing free? Do I have to pay for testing every time I get tested?
So at Polk Health Department, we have a really low cost testing. So what it means is you can get tested for gonorrhea, chlamydia, syphilis, HIV for $10. Okay, Within that $10, if you're a Polk County resident, you get your medicine. So let's say you test positive for gonorrhea, chlamydia, syphilis. You test positive for all three. You get tested and treated for $10. Okay, so think about that's like Starbucks. That's like, you think about what $10 is. We never would make you, if you don't have the financial means, we would never make you pay for it. So testing at most places is low cost. If you have health insurance, it is free with how testing is, with how health insurance is written right now. STD testing is preventative, so you should never be getting charged for getting tested for an STD. Alex is very right. What you need to do is every time we say you have unprotected sex or a new sex partner, we'd like you to be getting tested. So ideally, we'd like to say every 3 months. So it's about every 3 months. Now, whether you're with the same partner, I've been with my same partner, my husband. I've been married for 3 years. We've been together for 5 years. I still get tested every year. Why? Because I trust my husband, but I also know that my own health is more important. You need to be your own health advocate. I love my husband dearly. I know he's not stupid. He would never do that. But you have to also be your own advocate for yourself. So that's why no matter how long you've been in a relationship for, you always need to be getting tested.
Okay, Brittany's going to ask one more question. And once she does that, then after her question, Nola, I'm going to turn it over to you for final thoughts. Alex, over to you for final thoughts. And then our host, because I know we need to be wrapping things up. This has been a really great conversation. Brittany, I'll turn it over to you for your last question, and then we'll turn it over to Nola for final thoughts.
Just a quick question, just for some of our viewers. What are some signs? Like, so you're saying sometimes you don't know that you have it. If you say you don't have several partners, or, what are some signs that, one can see?
So I never like to say they're signs or symptoms, because the most common sign or symptom is no signs or symptoms.
Okay.
Like, look at gonorrhea and chlamydia. Majority of our community will never have signs or symptoms with that. The same thing with syphilis. Same thing with HIV. So you cannot look at your penis or your vagina for discharge, or for sores, or for bumps, or for pain, because the most common symptom is no signs or symptoms. So if you are having unprotected sex, you are having sex with multiple partners, you need to be getting tested. And so that's what we always tell people. The most common sign or symptoms is that there are no common signs or symptoms.
Thank you.
Simple as that. We want you to get tested. We want you to get tested often. At the health department, we have when we are successful in our job is when we build that confident, open relationship for our community to not have any stigma when it talks about sex.
Perfect. Thank you, Nola. Alex, any final thoughts?
I can just add on that, but my final thought would be still focusing on stigma and discrimination that has caused AIDS to still be the threat today. But I will add, the reason that you need to be tested is that I can have HIV from how many years without knowing that I have HIV. But you can have HIV for only 1 year and you'll be sick, you'll be almost dying, right? It just depends on how everyone's body, the way your body is that's where you can resist to anything. So what I say is that since I can spend many years with HIV in my body without showing symptoms, it depends on how you are. You need to get tested to know that's your result. You need to always get tested. And my final talk on this stigma and discrimination, what is that? We have this theme of the year where we talk, and there's this part where we say everyone's voice, right? We need everyone's voice. So we need to be talking about, if you have any thought on HIV, you don't need to just keep it in your head. Just we educate to spread the knowledge. I'm talking right now. If you're live, if you're listening to us, just educate your friends, your colleagues, so they know the actual truth about HIV And then the stigma, when the stigma is no longer there, people will be able to come out freely, will be able to tell their partner that they're HIV positive, so their partner can take measures of protect or prevention, or they can just be free to know that I'm living with someone who is HIV positive. I need to remind them about their medication so I don't get HIV.
Yeah.
So we need to just be, I don't know, everyone need to be the ambassador of the other. We need to be the ambassadors. Thank you so much.
Duana?
You know, after hearing everything, I feel like I've learned a lot more than I did not know. And I think a lot of those things I learned were probably from other people in my circle or just, you know, other spaces and places. So I'm thankful to you, Nola and Alex, for being with us today just to provide us some information. I think what I take from all of this is education is key. We don't know what we don't know, but it's time for us to start educating ourselves about things like HIV and our sexual health, and not being afraid to have those conversations with our young people. It's very important and key. They are looking to us to have those conversations. You need to be a person that they are comfortable with in having those conversations. So if a young person comes to you, parents, if your kids come to you, do not tell them, no, don't do it. Sit down and have a conversation with them so you can educate them more and give them the truth. That truth may cause them not to want to have sex. That truth may still cause them to have sex. But if they do choose to have sex, hopefully they're choosing to do things very responsibly. So I appreciate the conversation and looking forward to a part 2 of this conversation sometime next year. Rob?
So I know a lot of times y'all see me, I'm joking around and stuff like this, but this stuff is very serious. People can die from this. This stuff can be spread. And so we want to make sure, and this is why we do this show. We do this show because there are differences of opinions that sit right here on this show, that sits behind the scenes on this show. I do want to mention really quickly that we are live from the studio in Windsor Heights. And if you have or need an event space, you are available to rent this private space by calling 515-996-0326. Please, if you want to use this space that we're using, feel free to do that. Now, when we look at what's going on and what we just discussed today, it's going to make some people very uncomfortable. It's going to make some people really question some stuff. It's going to push people outside of their limits. And you know what? That's okay. It's okay because we're living in a world where I'd rather you be uncomfortable than us face a public health crisis because you decided to be, because you wanted to stay comfortable instead of being uncomfortable. Our babies are having sex. You are having sex. Your parents had sex because that's why you exist. Somebody had sex. So at the end of the day, this is happening. And so we have to take this very serious. And I know I joke about it because even sometimes I'm uncomfortable. But at the end of the day, this is where we are. So I just want to remind everybody who is watching, who will watch, who tune in to us, who support us, that you are loved, you are valuable, and that you are important. Because if you weren't, we wouldn't do topics like this on this show. Because it truly is about making sure you have what you need. We love you. And we'll see you next time on the Urban Impact Show. Thanks for watching.